Thank you.
All right.
And it's okay with you if I record using my phone?
Sure, no problem.
Okay.
All right. So just to summarize here, you were discovered to have this right MCA aneurysm during the workup of dizziness, essentially. And you had an episode at some point of left eye blurry vision, right?
It was minimal, and I wasn't sure it was really that, but...
When was that?
It was well before I went in on June 4th. It was like the beginning of June or the end of May.
Of this year.
Of this year, correct.
Yeah. So we did the angiogram in October, just earlier this month. You did very well.
Thank
you recovered from
You
that.
did very well.
Well, and we found a whole bunch of stuff. Okay,
I know.
Yeah. So we saw the aneurysm, right? So the right-sided aneurysm. And I would say that it only has mild dysmorphism, meaning that it's not very misshapen. It's pretty much circular in shape.
Yep.
And it's about 4.5 millimeters in maximum diameter. So that's the biggest measurement that we can take of the aneurysm. So we would consider that a small aneurysm.
But it's got a wide neck.
It does have a wide neck, that's a signal to me that it's more difficult than average to treat. Okay? So for that aneurysm, and you also have, I'll just jump to the other side of your head, on the left side, in almost the same position, you have a very tiny little, less than 2 millimeter blip in the same general location, and we would consider that aneurysm tiny. So you have one small aneurysm and one tiny aneurysm.
Yep.
Do you have a family history of brain aneurysms?
No, not that I know of.
What I would recommend for your aneurysms is to watch them. I think the risk of me treating them is probably higher than the risk of them causing you a problem. And we'll follow them every year with an MRA scan. So it's like an imaging study that's not invasive, doesn't require any radiation, no contrast. And we'll take a picture of it every year. And if the aneurysm grows or changes shape, that'll be a clear trigger to do something. But I don't think we need to jump the treatment yet, because I think your lifetime risk of this being a problem, rupturing is the problem, is very, very low, less than, 1% or 2% over the course of your life.
Okay.
Okay. The things that you can do to reduce the risk of the aneurysm causing trouble are: don't smoke, keep your blood pressure well controlled, and don't binge drink alcohol. So don't drink so much alcohol at once that you fall off a bench drunk, sort of thing. Don't drink like a college student.
I don't think I've ever done that, but okay.
Do you smoke?
I do.
Are you going to try to stop?
I am.
Really makes a huge difference. So I would really double down and make sure that your blood pressure is well controlled. Okay, so that's the stuff in your head. Now there's a little bit of stuff in your neck. So you have what I would call, usually when we talk about the pipes in your neck, we talk about rust buildup, like atherosclerosis buildup, the stuff that gives you a heart attack when it builds up in the blood vessels in your heart, that it can also build up in the blood vessels in your neck. You have something slightly different than that, which is that you have what I would call a web-like structure on the right, which is causing a little bit of turbulent flow. And that can predispose to stroke. So I think for you, it's important that you're on some kind of blood thinner, like maybe 81 milligrams of aspirin.
I am.
Perfect. I would continue on that, and a statin medication.
I am.
So something that's perfect.
But I'm taking a very low dose, so maybe the dosage should...
No, I think that's good. I think it's just protect.
And John Gaudio is my cardiologist, so he's on top of it.
Perfect. On the other side of your neck, you have something that looks a little bit uglier, which is like either an ulcerated plaque or a pseudoaneurysm. And that, ironically, is on the side that you had that episode of blurry vision. And it's possible that there was some slowed flow that formed some clot, and then it spit off some clot up into your head and caused you to have maybe a mini stroke in your eye that you recovered from very quickly. But I'm actually more concerned of all the lesions that we've talked about. I'm most concerned about this thing in your neck.
Yep.
And I would actually recommend treating it, And the way that we do that is just by putting in a stent. and you have to be on some blood thinners in addition to the aspirin. We put you on Plavix, which is a stronger blood thinner, and we can work from your leg, and then we just place a stent, and when the stent heals, it'll exclude that pseudoaneurysm from the circulation.
And will I have to take that medication forever?
No, it's 7 days before the surgery and a month after.
Oh, that's good.
So total of almost like 5 or 6 weeks.
Okay.
The risk of me causing a stroke during that procedure, but I think the risk is lower than just leaving it alone, honestly, over the course of your life. So that's what I would recommend for you here. It's called a carotid angioplasty and stent, and it's to fix this worrisome ulcerated plaque.
I think my mother had that.
Did she?
Dr. Gaudio will know. She did have carotid artery surgery.
Yeah, it's for that type of thing.
I'll ask him about the history there. But yes.
Yeah. So that's what I would recommend. So for your aneurysms, we'll follow up. For the right-sided web-like thing, it doesn't need to be treated. Aspirin's good enough. But for this, I think we should put a stent in to counter it.
Okay.
That's it.
I'm game. Okay. When do we do this?
My office will give you a call, so you don't have to do anything. My office will call you, and we'll get you on the medicines and get you scheduled, and hopefully in the next few weeks we can get this done for you.
Okay.
All right. You'll see all the other bad things that can happen in my note that I'm going to send to you just in 2 seconds.
Yeah.
But the big thing is stroke.
Yep.
So, okay. Okay. We'll talk to you soon, okay?
Thank you. Nice to meet you.
Right.
I thought maybe I'd be a candidate for your specialty, the web thing.
The web? No, you don't need it.
Okay. Okay.
If I were to treat your aneurysm, we would use a web, but I don't think you rise to the occasion yet.
Okay. Thank you.
All right. You're welcome.
Have a good day.
You too.
Bye.